Доброго ранку. Доброго ранку,
Good
шановні пані.
morning. Good morning, dear ladies and gentlemen. This is my greatest pleasure to see all of you. I was looking at you gathering here. You are all smiling. You're all so inspired. I believe this is due to the fact that you have an opportunity to meet each other, to spend this time in a very fun way, and because you do great things. Thank you so much for being here today. My name is Timur Miroshnachenko, and this is the greatest pleasure for me to spend this day with you. Good morning. Let's applause to each other.
Ми з вами тут.
And we have gathered here physically in Kyiv at Parkovy, but at the very same time, we are connected online with colleagues across the country, hundreds or thousands of them. We can say virtual hi to them. Thank you for joining us, though online, but still, this is a huge thing. And we are saying hello from Kyiv, and again, a round of applause from you. But this along demonstrates, I mean, how many people are here, how many people are there next to their gadgets. It shows that we have a strong and vast community in every corner of our country. Representatives of government institutions, international partners, the healthcare community, educational institutions, civil society organizations, and communities. And you're all part of the changes that are moving Ukraine forward right here and now, today. And today we are celebrating 6 years of working together on the support to be control efforts in Ukraine project. And again, it deserves to hear the round of applause again. And these 6 years have been years of partnership, innovations, and for sure, humanity. And we look back to remember how much has already been done, and at the very same time, we look ahead into the future, where even more Ukrainians will have access to care close to their homes and in their community. That is very important. Today is both a day of conclusions and day of celebrations. This is a recognition of our joint efforts and gratitude to everyone who stood by us. And this is also the beginning of a new dialogue about sustainability, care, and healthy future of our country. And for sure, we clearly understand this, and we know that we can do all these incredible things today thanks to our defenders and their bravery. And they are those who never stop 24/7, regardless of the circumstances of the weather outside our window. They are protecting our future. So, again, a round of applause to each and everyone defending our country for 11 years.
Дякую.
Thank you so much for this. And I strongly hope that they would feel, though through distance, the support and love we are standing their way. But before we move on, let's pause for a moment, because we are here today, but someone gave their life to actually make it all possible. Our defenders, our volunteers, our medics, ordinary Ukrainian who did not leave to see this because of the actions of the Russian Federation. This is a moment of silence for them. This silence is our gratitude, and this silence is our remembrance. And I ask everyone to honor them with a moment of silence.
Слава Україні!
Glory to Ukraine. Glory to heroes.
Дякуємо. Дякуємо.
Thank you for this.
З вас,
Thank you to each and every one of you. And actually speaking, we are ready to move to the solemn part, the opening of today's event. This day for sure is about all of us, but there are people who actually set that direction, they inspire us, and they keep the course of change. These are the ones who have walked this difficult but important path with us, and we are honored to invite them to deliver welcoming speeches today. And now, with the greatest pleasure, I invite the first speaker of today, Igor Kuzin, Deputy Minister of Health of Ukraine and Chief State Sanitary Doctor of Ukraine. Dear friends, dear colleagues, this is my greatest pleasure to be here today and really summarizing something important like this. 6 years of the project, this is really a solemn event. This is difficult to imagine this very project if to compare with the situation it started with, because we really planned to support the efforts of the country in countering TB, and the goal was for the country to properly respond to TB pandemics more efficiently, in a more sustainable manner, to be implementing certain innovations. But actually, the project faced the challenges of COVID as well as the challenges of war. And we need to pay due to all the members of this project, because actually it has demonstrated its internal sustainability, resilience, and had proven that all those innovations being implemented and all those ideas the project implements is really flexible and really important and useful. Unfortunately, Ukraine ranks not among the first countries if to speak about TB infection, and this project was of paramount importance for the country in order to mobilize the available resources and in order to boost the efficient transformation of anti-TB measures. Within the 6 years of the active implementation of the project, more than 100,000 Ukrainians were covered. Over 200 testing sites were opened that were used by the residents of the communities. Thousands and thousands of patients got access to treatment. And I would like also to highlight that this is one of the projects that started working with the regional CDCs, and it had its own influence on the system of public health. Actually, it was taken into account all the current context in the young system of public health care in Ukraine. And actually, a lot will be mentioned by partners today. We were dealing a lot with countering stigma and discrimination within this project. We understand that adequate attitude towards a client, a patient, destigmatizing one, is a sign of a healthy society and is a Euro-integrational norm, which is why the project was that only driver which gradually was introducing the philosophy of ethics of destigmatization as regards TB patients, together with patients' organizations, and for sure together with those providing medical care. I'm pleasantly stunned by the team that was working on the project, because this is kind of a small group of people, believe me. These are just few leaders who were in Ukraine all this time and who were going to the most hard-to-reach communities in Ukraine. They were communicating with clients, with doctors. They were helping with their expertise. They were supporting with funds and were helping to introduce innovations. And one of the most innovative solutions that was introduced by the project was an eye in diagnostics of TB. And we see that this very area is very promising. And really, the whole world is paying huge attention to AI, especially in the diagnostics context. It was the greatest pleasure for me to work with this project, and from the bottom of my heart, I wish this project to be successful in the future, and I wish all of you next rounds, because this team is very efficient. They work very efficiently with one another, and they are very patriotic and country-oriented. So I'm very grateful to people of United States, to the government of US for supporting this project, and that you've actually decided to select, namely, this organization as your implementing partner. And I'm very grateful to all the other partners that supported implementation of this project at various levels, starting with the leaders of the communities, wrapping up with the chief physicians at the level of the hospitals, from a patient to the representatives of NGOs or professional associations. Thank you for this activities, and I wish all of us to actually take the best what was in this project and use it in the future, because it's really worth it. Thank you so much. Thank you, Mr. Ihor. This round of applause goes to you. Thank you for these warm words and for dedication to the project and to Ukraine.
Ну а зараз, дорогі друзі, до вітального
And
слова
now,
запрошую
dear friends,
Олексій
let me
Даниленко,
give the floor to Alexei Danilenko, Acting Director General of the Public Health Center of the Ministry of Health of Ukraine.
Вітаю, шановні колеги.
Greetings, dear colleagues. It's an extreme honor for me to address all the participants here on behalf of the Public Health Center. This event, where we all gathered today, summarizes 6 years of very intensive and meticulous work. The project, supporting efforts to combat tuberculosis in Ukraine, is a bright example of how international partnership, modern technologies, and the professionalism can really change the situation for the better in healthcare. With joint efforts, we managed to make treatment more available, diagnostics faster and more precise, and the patients are more protected now. For the Public Health Center, this project has been and is very important, because it helps not only in the sphere of TB, but it lays the foundation for the sustainability of the public health system overall. Its uniqueness is in merging the clinical innovations with systemic reforms, infection prevention and control, episurveillance, data management. For the Public Health Center, this partnership is an important element in our work. We've received not just new possibilities, but the new standard for cooperation between the public institutions, the communities, and international organizations. At the moment, the National Program to Combat TB undergoes a comprehensive evaluation by the WHO Euro Office. Our joint efforts have been highly appraised by this renowned international institution. And I would like to express sincere gratitude to our international partners, the government of the United States, PAF, the Embassy of the United States in Ukraine, and all the national and regional colleagues, physicians, communities. Your dedication and your daily work is the real strength, which is the foundation of Ukrainian health system. Today, we're talking not about the achievements of the past, we are talking about the future. I'm confident through partnership, through trust and professionalism, we'll be able to do much more. Not just to combat TB, but also to develop the sustainable and modern system of public health in Ukraine. I would like to congratulate all of us with the completion of this important project to support the TB program in Ukraine. Indeed, it's a remarkable milestone. It gives us the possibility to do the deep analysis of the result, to aggregate the best practices, and to critically evaluate the challenges and the less effective initiatives. This experience is highly valuable for further improvement of approaches in public health. I would like to say thank you so much for your attention, and I congratulate you all once again with the successes we've achieved through this project. Thank you.
Пане Олексію, дякуємо вам. Дякуємо вам.
Thank you so much. Thank you for these words, and thank you for the work you've been doing at Public Health Center daily for Ukraine. Now, I'm giving the floor to Katarina Gamasina, the head of Path Office in Ukraine.
Шановні колеги, доброго ранку.
Good morning, colleagues. It is great honor for me to welcome you on behalf of PATH. 6 years of this project have passed quickly, and it took very long. We know the challenges Ukraine and the whole world had to experience. I will not be repeating my colleagues. Both Igor Volodymyrovich and Alexei Mykolavich already have mentioned the complications and the challenges which the project has faced in its period of operations. But I would like to mention the experience of PATH overall in countering TB and in helping Ukraine. We've been working in Ukraine for 30 years. This year we celebrate the 30th anniversary in Ukraine. But in TB, we've been working for 25 years, a quarter of the century. And I remember how it happened 25 years ago, how TB control changed overall, how our work changed, how our work grew into partnership, into real synergy, providing this power to change things. Mr. Kuzin mentioned that we still have a high incidence. Well, they are much lower than we had them some time ago, and actually much lower than we could have had them in the given circumstances when we have lots of migrations, internal migrations. Our healthcare still stands, even though it suffered a lot. So now our organization implements projects in over 70 countries globally. And of course, we enrich our experience in Ukraine with the experience from other countries, but actually, I think even more goes to our experience in other countries, because here in Ukraine, we implement the best technologies, we test them, and we help them integrate into the routine healthcare system here in Ukraine. And it's first and foremost, this implementation of all the innovations comes through all of you, through the partnerships we have. And I would like to say thanks to our national and regional partners, the Ministry of Health, Public Health Center of Ukraine, the regional departments, Centers for Disease Control and Prevention, and the communities. Probably the communities are the first and foremost. And of course, the NGOs, national, international, our academic sector, and everyone who make this partnership possible, who help us integrate all these efforts at all the levels of care. It really shows the result now. And special thanks to the government of the United States of America, to the Embassy of the United States in Ukraine, and to the International Aid Department of the State Department of the United States. Your support is not just funding. It's about strategic vision. It's about reliable partnership. And it's about this feeling that we're not alone in this fight. And now, in the darkest hours, we see that there is light ahead. This is the light of partnership, the light of shared responsibility, and the faith in better future. And I'm confident that we have new achievements in the future because jointly we can achieve much more than we already achieved. I would like to say thanks to all of you, and I wish you not only informative but also a happy day because we have a celebration. So let's celebrate our achievements. Thank you so much.
Дякуємо вам, пані Катерино, за ці
Thank you,
слова.
Katarina. Thank you for these words. And of course, we can give even more rounds of applause because we thank that Path has been a real friend and partner of our country for so many years. Now, it is my great pleasure to give the floor, and let's start the applause now to Ms. Gunta Dranica, the director of the project to support efforts to combat TB. Dear colleagues, dear friends, it is my great pleasure to see you all today. For me, this project is not just a work, it's a big part of my life. I've been working in PATH for over 5 years, but my story with PATH started over 25 years ago, because I remember how colleagues from PATH came to Latvia for a training, at a training session. Then later, we were implementing new regiments with PATH. And back then, over 60% of patients with axial TB were dying. That was just scary. With the support of the US government in 2017, PATH started helping Ukraine implement new regimens using the bedaquiline and etamine, the new vital medications. And this was the new breakthrough. And we didn't stop there. And when in 2019 the project supporting efforts to combat TB in Ukraine started, we developed it further jointly with the NTP, with the TB Institute, with the WHO. The project introduced new, shorter regimens of treatment and started implementing them in the regions of Ukraine. The project also has provided the support in early diagnostics and prevention of TB, supported the detection of contacts of people with TB, expanded access to the diagnostics of TB infection, and helped implement the national protocols for multiple resistant TB, and helped improve the communication between the primary level and regional CDCPs. And of course, children are always a priority. Then the pandemics came, then the war. But we not only continued, we've expanded. Through the support of the United States government, we've been restoring accesses to services destroyed by the war. We reinforced the primary care capabilities for doctors and nurses. Jointly with the communities, we introduced the screenings for non-infectious diseases, which covered over 100,000 people. Today, we will not be giving long presentations with endless figures. We pause to look at each other, to smile, and to recap the path we took together. You will be hearing stories, and you will see examples from our partners and colleagues from the regions, their experience, their strength, and their innovation. They are inspiring us the most because they show how joint efforts help saving lives in the direst hour. And remember, a lot of these colleagues have been working in the regions under shelling. Despite the war and despite the dangers, they are not only continuing to provide care, but they are moving ahead. They implement new approaches and achieve success. This bravery is what we celebrate today. I would like to say thank you. Thanks to all the partners at national, at regional and local level and communities. I would like to say thanks to my team at PATH. I appreciate everyone, those who are seen, those who work behind the scenes, the whole organization, the financial team, and our office administrator, Volodya, who takes care about the office so that we all would be able to do our job. I would like to say thanks to the team who made this event possible. especially to Alexei Kosivchenko for his creativity and his attention to detail. So let us celebrate. It is not the end. This is not the closure. It is a stage, a step. Through U.S. government support, we are moving ahead together into the next chapter to build a stronger and flourishing Ukraine. Thank you.
Дякуємо, пані Гунто, за ці слова. І
Thank you,
ще раз
Gunta. Thank you for these words. Now let us once again say thanks to the team which is behind this project.
Так, дорогі друзі, 6
Now,
років, так, це
6 years. It's thousands of stories and one big shared objective. And of course, every result has people behind it. Their dedication, their work end up achieving this result. Of course, we cannot recap all the 6 years in a few minutes because the project has introduced just many more achievements than we can showcase. But this one short story would help us see the atmosphere of shared work and to show a few bright moments. Welcome, and thank you for joining us. So that we would recap the path of the project, supporting efforts to combat TB in Ukraine. This video celebrates an important stage, 6 years of innovation and resilience. This is not the end, but this is the moment to think of the achieved and to glimpse into the future, to see what lies ahead. These 6 years have been marked by tremendous challenges in the implementation of the project, in our personal lives and in the lives of all Ukrainians. But we all stayed together. We have overcome, shoulder to shoulder. We appreciate the United States government for the ability to deal with the challenges in real time. Even though our official name is supporting the effort to combat TB in Ukraine, but U.S. government has actually expanded our portfolio and resources so that we would be able to help respond to emergencies and help recover critically important services. We've started in 12 oblasts, and now the project covers all the territories under Ukrainian governmental control, always in line with the local needs and in coordination with the partners. The main priority is strengthening the capabilities of the health workers and community representatives. The project has created 3 certified regional hubs in Kiev, Lviv, and Dnipro, which train thousands of TB doctors, nurses, family doctors, and community leaders. With the support of the project, the National TB Hub has also launched a virtual training platform, a modern online resource with interactive models, clinical case studies, and real-time discussions. So the Ukrainian medical specialists would have the up-to-date access to global knowledge. We facilitate their participation in global events like the Union Conference and the Congress of the European Respiratory Society. And jointly with the partners, we've strengthened the capabilities of TB specialists in 8 regions, having improved their communication skills so that the patients would have better adherence to treatment. The stress caused by the pandemics and war has required other solutions. We've introduced psychological support to strengthen the resilience of health workers, to improve their interaction with the patients, and to achieve higher indicators for the treatment completion. Limited access to diagnostics has been a barrier, especially in rural and in war-damaged areas. The project, supporting efforts to combat TB in Ukraine, has implemented a series of innovations. Mobile and portable digital X-ray, AI to analyze the imagery, and the information and analysis system. The project has brought diagnostics closer to people by the provision of vehicles and portable X-rays for the TB clinics and the AI-driven digital X-rays for the primary care. The teams have received fuel and personal protective equipment, which enable them to work continuously. And now the examinations are available in rural areas and in IDP communities, and the preliminary assessment through AI has shortened the time to treatment. The implementation of the AI helps interpret the X-rays in real time, because the AI would immediately mark the changes which could be caused by the TB, so that the sputum specimen would be instantly collected and the referral will be initiated. 15 regions now have this information system. This technology now enabled uploading all the imagery to the cloud, so that radiologists would be able to analyze them through a QR code link, and it's integrated with the national system. Now the doctors can instantly refer patients to ensure the continuity of treatment. The project has helped overcome the critical barrier in access to TB diagnostics through the engagement of private laboratories. And from 2021, over 10,000 people from the risk groups have been tested with the point-of-front test. And also, we've invested in the clinical capacity development, so that the doctors would understand whom they should test, how to properly interpret the results, and how to pass the well-substantiated decisions. That is why the obsolete isoniazid 6 months treatment was substituted with the newer, shorter regimens and contact tracing. Over 80% of the contact persons of people with the MRTB has started preventive treatment, which is a breakthrough in the prevention of TB in Ukraine. For children, as part of the project to counter TB in Ukraine, fecal examination through Expert MTB RL Ultra was initiated in 12 regions, and the specialists of the project have cooperated with the reference lab of the Public Health Center and the organization KNCME to prepare the methodological guidelines, the protocols, and the video manuals in Ukrainian. Training, mentoring, and supervision for the clinical and lab personnel ensured the comprehensive implementation, and the results were already published in a peer-reviewed international journal. The pandemics and the war in Ukraine have made the switch to outpatient TB treatment faster. More and more patients are getting the treatment in outpatient settings, and digital tools are implemented for that. Smart boxes for pills, and supporting the video-observed treatment. 11 regions have already implemented those, and over 5,000 patients have been registered in this system. In Kirovohrad Oblast, this technology is also used for the monitoring of the preventive TB treatment. These tools facilitate the autonomy of the patients and make the path of treatment easier. And medical workers now have real-time access to information to make timely decisions. In partnership with TB People Ukraine, we've created children's resource room in 5 regions. These are safe spaces where children and teenagers who are treated from TB receive psychosocial support. They get some health knowledge and individual counseling on different ways to ensure adherence to treatment. Over 3,000 counseling sessions for children and parents have been conducted. The project also supports training materials for children and families and methodological guidelines for the teachers. There is a cartoon, Become a TB Researcher, and there are questionnaires to assess anxiety, guidebooks for the parents, in order to strengthen the preparedness of the public health system. In October 2022, the project supporting efforts to combat TB in Ukraine has implemented the sewage monitoring to identify SARS-CoV-2 and influenza. The mixed sample of sewage is analyzed, and this helps analyze the population level circulation of the agents, or the pathogens. It's non-invasive and it facilitates the general episurveillance of diseases. This works as an early warning system for the outbreaks and helps with the preparedness. And this activity has been now funded from the public budget of Ukraine, and it's integrated into the Ukrainian healthcare system to strengthen the capacities of the labs in Ukraine. The project supporting the efforts to combat TB in Ukraine has supported the procurement and implementation of the modern laboratory information system for the Public Health Center at the MOH of Ukraine and the regional centers for disease control and prevention. For this system, the data of examinations are input, tracked and transmitted in real time, which decreases the risk of errors and improves the performance. Now the system is fully funded by Ukraine, the processes are standardized, and data quality is ensured. The support of facilities in infection prevention and control is also one of the key works of the project, and special attention was given to the role of the nurses, those who are daily on the front line of safe care for the patients. We'll implement the training program on infection prevention and control for the medical colleges and nurses, which has been piloted in Kyiv and Ivano-Frankivsk. The project helps facilities of community partners implementing the best practices. UV radiometers were procured, and the AMR is supported in ensuring the episurveillance of nosocomial infections and the implementation of hand hygiene standards and medical cleaning. The project also pays lots of attention to strengthening the potential of the infection prevention and control units in the regional partners and the national level. Specific trainings were provided, including the trainings on ventilation control equipment, which was procured as part of the project, and we've delivered also the corresponding SOPs to the Center for Public Health. And also, respiratory diseases are an important challenge in Ukraine, and the war since 2022 has complicated access to healthcare, especially in rural and remote communities, which also increases the risk of tuberculosis. To overcome all the challenges, the project has created 234 screening points in 11 oblasts, where 100 people have already been tested. In these places, they test for cardiovascular diseases, diabetes mellitus, cancer, and emotional health problems, starting from 18 years old, and they provide recommendations on healthy lifestyles and disease prevention. Those who underwent this screening for cancer, one of 4 of them required additional examination, which shows the importance of these services. These examples show only a small part of all the achievements from the project. The services are better, the tools are innovative, the specialists are resilient, and the communities are well prepared. We appreciate the United States support for Ukraine in these in the troubling times. This only is possible through our partners at regional level and in local communities. Thank you so much. Our team remains strong, resilient, and dedicated. And we will be working in the future to support the health system in Ukraine, being shoulder to shoulder with the communities and building the future in which medical care would be available, continuous, and people-oriented.
Так, ще оплески. Дійсно,
More and more Rounds of applause. It's really 6 years. It was a complicated way, but we've seen how much was done. And really bravo to each and everyone who had anything to do with these processes. Let us express a gratitude to everybody who was part of this story. US government, PATH, team, partners, communities, and each and every one of you. Thank you so much. So, dear participants of the conference, now it's time to listen to the voices from regions, those who work on the ground every day, those implementing innovations and bringing help closer to people, to those who need it. And now, within an hour, we'll be speaking about mobile X-ray devices that make it possible to conduct examinations even in the most hard-to-reach communities and regions. We'll discuss the up-to-date approaches to TB detection, the use of AI, artificial intelligence, to interpret images, and a radiological information system that brings the results together. And this is especially important now when, despite the big war, the full-scale war, specialists in the regions are eager to develop, update approaches, and implement new solutions. But when it comes to children, it's not about technology in the first place. It's about comprehensive support from pediatricians, psychologists, medical teams who help adhere to treatment and make the experience of countering TB less painful for children, for their families, and make all this process more humane. So let us proceed to the first panel discussion, which is called Voices from Regions, Innovations that Bring the Medical Assistance Closer. And a round of applause to Zhanna Karpenko, head of the Separate Structural Unit TB Center of Chernihiv Regional Hospital. Please take any seat you like. Yulia Dudko, radiologist at the Chernihiv Regional Hospital. Olena Semenova, coordinator of the Program Department TB People Ukraine, and Victoria Kukta, psychologist consultant at the Multidisciplinary Resource Room for Children and Adolescents undergoing TB treatment, and their parents at the Kirovohrad Regional TB Medical Center. Once again, a round of applause to all the panelists who have already joined us here on the stage. So, let us start. Ms. Zhanna, let us start with you, because Chernihiv actually was one of the first regions to start mobile X-ray screening with the support of the project under consideration. Why was it necessary, and how did you start, and what actually has changed during these times? Greetings, dear participants. Let me start saying that one of the key approaches to countering TB would be active identification of TB among risk groups, namely with the help of TB screenings. I've got some slides here. May I have a clicker? Great. So in 2021, Chernihiv region started its activities in this very area. For sure, this all started with the support of the project, and the reason for this was a severe clinical condition of patients when TB is identified. We had significant decrease in TB statistics, but we saw the greater mortality because of TB and limited access to the TB screening among people who live in rural areas. So before the TB clinic would move anywhere, we had this mobile TB screening device at our clinic. A lot was done. So we started all these activities together with the regional CDC. We started visiting various territorial communities, but it all required support from the local mayors, heads of the communities, local physicians. We were thoroughly planning all these visits, and that's how we started working. At this slide, you can see what kind of cooperation we had between TB experts, family physicians, experts of the territorial communities, regional CDC, as well as non-governmental organizations, NGOs. As soon as we started these activities, we faced certain challenges. The first one was the huge number of those willing to undergo an X-ray examination. Having analyzed our work, it became clear that in order to identify one TB case, we needed examining 120 residents of the community. So we made a decision that before the X-ray device would go to any community, we need to have the lists of those people who really required the X-ray screening. Then the next challenge was that for an extensive period of time, since the moment of examination till the moment of getting the results, family physicians actually could not get these findings very quickly, and people were lost. People with X-ray pathologies, and it was quite difficult to locate them, and sometimes people were lost completely to follow up. So, yet another problem was the following. Sometimes we find people with X-ray technologies, but for an extensive period of time, they could not come to any clinic to continue these examinations. So, with the help of the project, and we were greatly supported by Chernihiv Network NGO, they decided to help us in this regard. They were actually responsible for transporting people with X-ray pathologies for further examination. This being the case in 2021, thanks to the mobile X-ray device visits, we identified 21% of people with TB out of all the registered cases. So our contribution was this 21%, and then they were linked to care. Then 2022 comes, the war. We lost all the resources, including our mobile X-ray car. So the TB clinic became part of Chernihiv Regional Hospital, and we were greatly supported by the project back then. For example, we got the up-to-date portable X-ray machine from the project, as well as the X-ray protection overalls and a new car. We've developed SOPs on active identification of TB by X-ray screenings, and with the support of the director of Chernihiv Regional Hospital, Zhdan Country, we started visiting the communities again. Also, we started cooperating with the regional CDC, and the key area of these activities was actually examining the contact persons. So our X-ray machine was included and was taken on board the multidisciplinary team that was going to the hard-to-reach spots of Chernihiv region to examine people there. And for sure, you can see who was included into this multidisciplinary team. Here, it was quite extensive. And that being the case, we've managed to cover people with proper examination. I mean, those who were contacting people with TB, and this figure total 97%. Oh, that's fascinating. A round of applause. Ms. Jana, this is the applause to you and to your team for the dedication, because we all know that Chernihiv was the rim of occupation in 2021, and you are really located close to the front line. A round of applause to you and words of gratitude to all your colleagues. And also, Chernihiv was one of the first regions to start using digital tools for X-ray screening. To explain what these technologies are, could you use simple words to explain it? Why these technologies are important? Yes, previously, as our mobile X-ray mobile was coming to the community, 7 days had to be waited to get the result. And at the end of the week, this X-ray mobile would come back to the hospital, and there was the interpretation of the images. But now AI is actually preliminarily interpreting the images in the matter of minutes. Here on this screen, you can see a little black box that's there next to the laptop, and this is the software which contains the AI, and actually fluid inside. Next is you can see the images and in what way it interprets the X-ray images. So if AI identifies a pathology or suspects a pathology, lab technician would contact the X-ray specialist or TB specialist who would check the images in real-time mode, in an online mode, thanks to the special software we have at our institution, and the decision is made as regards the further examination of these people. If TB is suspected, then the biological material is collected and it's transported to the laboratory where we've got gene expert systems. And this being the case, we speed up significantly the diagnostics of TB, and we have the results faster. You can see our scripts. These are the experts of regional CDC of Chernihiv region. Now I would like to share a success story with you, which happened in our region. This was a young man, 44, newly identified TB, and we've notified the regional CDC about this case. They called on the multidisciplinary team. This multidisciplinary team goes to the settlement where this man resides. With the help of AI, we've identified 6 cases of lung pathology. After further examinations, we see 4 cases of confirmed TB. Out of those, 2 children, 11 and 12 years of age. All the patients were identified in a proper condition, and they started treatment. They've finalized the treatment now, and they are cured, completely treated. So also with the support of the project, we were conducting joint meetings. We were having experience exchange sessions where we could share our own experience and borrow the best practices of other oblasts or regions of Ukraine. And this being the case, we were welcomed at this union where we are going to share our experience even with other countries. And as a result of this great cooperation, TB specialists, experts of communities, experts of primary medical and sanitary assistance, and representatives of NGO, again, thanks to using AI and comprehensive approach, we see that we are really bringing the services closer to people. We have an opportunity to diagnose TB at early stages. We decrease the turnaround time from 7 to 12 days, and we've identified 21% with this approach out of the total number of TB identified cases, and more than 90% of people started treatment and they finished their treatment in outpatient settings. Then we managed to cover 97% of contact persons, and we've managed to achieve the statistics that 1 case is identified among 67, 95 persons examined. This is a great contribution for us. Well, it really sounds like fun, and it deserves the round of applause from you. Thank you, Miss Yulia. Let's proceed to you. Explain in simple terms. Yep, let's deal with the microphones. Yep, let's explain in simple terms, because I understand that we have people who understand it all, they are profound experts, but maybe there are people like me who do not know all this terminology. So what is radiology information system, what it stands for, and what it means for patients and doctors? Hello, I'm glad to see all of you here. So, what is Radiology Information System, RIS? This is the system that is being used in radiology units, and it covers mammology, CT, MRI, X-ray, and actually it covers and offers all the scope of services. Why do we need RIS? For patients, this would be a rapid registration of the findings of examination. All the findings are stored in a digital format. This helps avoiding losing patients' data or confusing this data with the data of others, and for sure, protected access to the findings of the examinations because we use the special barcode or passcode. This system is very useful for planning examinations and actually the cloud RIS helps us getting easy access to the images. The patient is referred to the TB specialist. The patients do not have to wait till the image is printed out. So patients go to their clinicians, and clinicians have access to all the patient's data in an electronic format. Then the automated creation of medical reports. You can see what the doctor is working on, what kind of samples, whether the protocol is ready, what device was used to conduct certain examination. Also, it's monitoring of all the tests performed, then an electronic line of patients and easy exchange of information between all the physicians, just X-ray specialists, but also clinicians. Yeah, you can see what it looks like. This is an image from RIS. You see the link and the QR code. You can use the QR code reader, and actually our chief IT specialist offered his lungs for your attention, for you to have a look in what way RIS works in your gadgets. So you've got the dashboard there, as well as the X-ray specialist would have. The only thing, when you use the link or the QR code, you won't be able to see the X-ray images that were analyzed by AI. Why? Not to confuse the patient, and for the patient not to be nervous after they see that their image was marked with some strange color. So here you can also see what RIS looks like, starting from ID of a patient, for sure, everything in an anonymous format, date of birth, then what was the modality to transfer this image. Then you see whether the physician is already working on this examination and whether the findings, the protocol of examination is ready. So this is yet another image. To the right, you can see that the image was not yet analyzed by AI. The second one is already analyzed. What's comfortable that you do not need to separately open up each and every image. You can have a look at those in dynamics. Also, with the support of the project and the leadership of our hospital, Chernihiv was one of the first regions where they started using inpatient heavy Axiga AI. This is the tool to analyze the X-rays of the chest cavity. Why AI? To assist X-ray specialists in precise and fast interpretation of X-ray images and to support clinicians during their night shifts, meaning a clinician might not be calling for an X-ray specialist, but on their own offer this image to AI and to see whether there's a pathology. What are the key opportunities here? That's processing an image within 10-30 seconds, provided the internet connection is optimal. And this way we can speedily identify anything suspicious. suspicious. AI would highlight the suspicious areas and will help the clinician and an X-ray specialist. It can identify early TB, pneumonia, pneumothorax, hydrothorax, fractures of ribs, etc. Integration with PACS and IRS, and the results are easily accessible for both a clinician and X-ray specialist. Well, what are the drawbacks of using AI? We will discuss it later on at a practical sense and zones. So actually here we speak about an efficient tool for the sake of screening and diagnostics of pathology of lungs. I would like to mention that, yes, majority of my colleagues were very skeptical to have such a helper. We call it Senya. Senya, our friend, Senya, our helper, but we have to understand that AI for us isn't a competitor. AI is a reliable partner in this case. This is like the second pair of eyes for an X-ray specialist. Don't see it as a competitor. Now, it's your friend. And I would like to highlight and actually summarize, it can never substitute a human being, a proper X-ray specialist, because an X-ray specialist would still check every image that was already interpreted by AI, and they always have the final word. You can see the X-ray image. Yeah, it was already analyzed by AI. You can see that in the findings, certain areas of the suspected pathology are highlighted, and the probability of pathology is mentioned as 94 here. So, this is yet another highlight from AI, the consolidation areas. The pneumonia was gradually later on confirmed. This image is very eloquent for me. Why? We work with AI starting from the 15th of March this year, and yet several months ago, the images could be interpreted only if the patient's image was produced in a standing position. But you can understand that sometimes we have to perform the X-ray in a prone position, in lying position, in sitting position. So actually, all the images would later on go to the statistical department, and actually they can inform the presence, absence of certain pathology in order to actually update and improve the capacities of AI. You can see yet another image here, which was interpreted by AI. So within this short period of time, we've identified this many pathologies, and actually TB was confirmed clinically in 38 cases. So, when AI is analyzing an image, there's this window. Attention, this report was created by AI, and it's meant just for diagnostical support of physicians. It shall not be considered as the final diagnosis, as the final report. So it's there just to be used by highly qualified healthcare providers. So AI is there to assist doctors, not to be a competitor. Every case requires verification on the side of X-ray specialists. AI can notice slightest changes that might not be noticed by a human eye. This is the second pair of eyes for us, for doctors, less routine, more time to be dedicated to complicated cases. And the final findings would every time be voiced out by the doctor, the physician proper. We had a clinical case of using AI several months ago. The standard X-ray imaging was done for this patient, and we see that AI highlighted this low intensity focal shadow, and it mentioned it as a knot. Well, the system identified a little knot in length, which could be unnoticed when this very image was considered by the TB specialist. The patient was sent to TB specialist, and TB was confirmed. So actually, this disease was identified at an early stage. The patient got timely treatment, and an X-ray specialist got persuaded that AI can really be a great ally. AI will never substitute or replace a doctor, just decreases the risk of missing important changes. Thank you, dear Julia. And I believe Kenya, which is the nickname of AI for you, it deserves a round of applause. And we are looking forward to have an opportunity to see it all at a demonstration site outside this room. And actually, those who are online will also have an opportunity to see it all. And Miss Lama, now it's my turn to ask you. Could you tell us about the multidisciplinary resource rooms for children and their families affected by TB? Sure. Hello, dear colleagues. This is also my greatest pleasure to see all of you. And starting answering the question of yours, let me mention that children are usually more emotional about perceiving the diagnosis. They have fear, they don't want to go to the hospital, take their medicines, and the huge self-stigma is there because of the disease. This are widespread phenomena. Yeah, I would like to show you my slides here. And on this slide, you can see children who were undergoing treatment, TB treatment, certain time ago. And these pictures reflect the emotional condition of these people. So the goal of our activities and the goal of our project was to make everything possible for each and every child to be covered with the full-fledged course of treatment and not to be subjected to any traumatizing events, any bad memories, because every child needs to feel support and care within their whole journey of treatment instead of fear, misunderstanding, stigma. And actually, this is very important to shape up adherence to treatment and successful treatment course and further socialization of this child and their back to their regular life. So with the support of the project, we've launched 5 multidisciplinary resource rooms at 5 TB clinics. And these spaces became a real support for children who faced the TB issue and members of their families. They helped little patients to go through this journey of treatment. Here on the slide, you can see what the resource rooms look like. In each and every room, there's an area for individual work of a psychologist with a child or with parents. There is an area for group lessons, group activities, and yet another training area. Sorry, I'm not very quick in switching and changing my slides. Let me bring this all back a little bit. Oh, I suspect maybe I would need some help here. Thank you for this. So, what kind of approach are we using in our resource rooms? In the first place, it was important for us to provide really comprehensive approach to both children and their families, which is why in our resource rooms we've got multidisciplinary teams that are comprised of, for sure, TB specialists, but also nurses, as well as pedagogues, teachers, and whenever necessary, a social worker would join. In these resource rooms, children are getting all the necessary psychological assistance and support. They're getting educational services, so they still have an opportunity to learn and develop. And we actually noticed that children are not scared to go to the hospital already after the first visit of the child and communication with the psychologist. Children are happy to go to such a hospital because they feel themselves comfortable there, and it's interesting for them there. They can vent out all their psychological tensions and fears. They can find some new hobbies. They meet new people. They find friends. And actually, they feel care and support, which is of paramount importance within the initial period of treatment. Thank you, dear Olena, for this interesting story. I will go back to you, but now let's actually listen to these practical approaches. Please, Ms. Elena, tell us in what way you work in practical plane and what support is your team providing? Greetings, everyone. I'm very happy to see you. So, in practice, it happens so. After a child is diagnosed with TB, after the treatment is prescribed, a physician recommends to visit the room of a psychologist just to communicate. And the key thing, to understand why, namely, the psychological support is important for a child, for a family, in the course of treating TB. But that's in an ideal case. But, we don't have that many ideal scenarios in real life. So there are not many children who love medical interventions, etc. Anything that's happening in the medical center might be stressful. So the psychologists start communicating with children, with parents much earlier than the child has got the already set diagnosis. We need to mention one important thing. A psychologist room is located right next to the doctor's room, meaning psychologist has got an opportunity to feel and even to hear the reaction of a child, to see the mood the parents are in, and in a timely manner to pick into the process. And we had children whom we met in September 2023. You can see them on the screen. These are the first pictures of theirs as we just welcomed them. By the way, they were brought to our clinic after their father died, who was treated for an extensive period of time. It was very complicated to deal with these children, and they were really scared. And regardless of their age, the boy was 11 and girls were 9 and 7. Regardless of their age, children didn't speak. They barely spoke. Older children were using some sounds, noises, and the smallest child was not speaking at all. It was obvious that children were traumatized growing up in their family, and we would not have an easy approach to these children. At the manipulation room, interventions room, children didn't want to contact with the third parties, with anybody from beyond their family. They did not allow doctors to touch them, to examine them, and also for sure they did not allow their blood to be drawn. The smallest child was really biting, screaming, yelling, kicking. And actually, the first visit to the medical center was something to remember for all the members of our clinic or every healthcare provider. But actually, we were in shock, but at the very same time, we understood we needed to proceed with diagnostics and treatment. So we started with very small steps. We invited children to the room. We just gave them some time to have some rest, to switch their attention to something else, to exhale, to actually feel this mood of communicating with others. We started with small steps, the hand washing, getting the water in the cup, from the cooler. Then they had a look at interesting books. By the way, as they were looking into the books, actually these big books, the Wimble books, here. This is some interesting pictures with tusks. And the smaller child, Jana, had proven herself to be of high intellectual ability. She was very quick with solving all the tasks there. She was actually pointing her finger at the proper pictures, but she was really traumatized. She was really scared. You can see it on the picture to your right. Older children were sitting by the table. They were wearing caps, as you can see. And they were not looking you in the eye. But the smaller child was always there next to the threshold, next to the door. She kind of felt some danger and she was about to leave the room at any minute. So we started with the small steps. And with every visit, it was becoming easier and easier. They were knocking on the door and they were letting the psychologist know that they are already there. And by the way, the children were taken away from their family and they stayed at the psychological rehabilitation room. And our team was in constant communication with other specialists to be sure that the treatment continues.
Then, from the Center for Psychological Rehabilitation, they ended up in a foster family. And when they came to us with the foster mom and dad, they actually pointed the foster parents to a psychologist's room. This is where interesting stuff happens. They have learned our simple algorithm and they endure all the examinations very bravely, and then they come back, they get some sweet things, some small presents, or they can produce these small presents at the type of a handicraft. And this foster mom and foster dad were really impressed by our stories, how the first visits of these children to the medical center happened. So we are friends. We're friends. Children, the parents, the health workers. So in the period of treatment, these children learned to draw, to differentiate colors. They've mastered desktop games. And we saw that they can show empathy, they can rejoice at successes of each other. But probably what's most important, during one of the games, we've heard the voice of the youngest daughter.
Кажуть оксамитовий. І чесно, нашій радості не було меж. Всі дітки успішно пройшли лікування. Зараз в їх
And all the children have underwent treatment successfully, everything is fine, and well, the disease sometimes may be forgotten, but this feeling of safety, of comfort, of trust that they felt for the first time in our center, it will stay with them for a long time. I'm sure you have many more of these stories, and the story of these kids is just fantastic. Thank you so much. Thank you for sharing. Olen, coming back to you. This program to support children and families, how does it affect the results of TB treatment? Let me start with the following. The problem of the children's TB quite some time has been not getting proper attention. Children were treated with the same approaches and same practices.
Необхідно застосовувати комплексний підхід, тому що окрім медичного компоненту для дітей дуже важливо враховувати їх певні вікові особливості розвитку, їх потребу у навчанні, у спілкуванні. Кожна дитина має свій психоемоційний стан, і яку також дуже важливо враховувати. Тому
насправді comprehensive approach, because besides there are educational needs that need to be considered. So we appreciate the project for the creation of these rooms where children and adolescents and their parents would receive the comprehensive multidisciplinary approach. Also, I want to note that another important thing is that as part of our activity, we could work not only with children, we were also providing the necessary psychological support to the parents, because essentially the family, the relatives are the first people to support the child in the whole path to recovery. But we often saw the parents accuse themselves, they blame themselves for the disease of the child. The parents don't know how to properly support the child and don't know how to motivate the child to take treatment. So the support to the parents which we provide is significant. It's important to make sure the adherence of treatment. Overall, in the duration of this project, over 700 children use this service. To be precise, 158 children received this service, and over 400 parents and family members got this service, which is an important indicator for us. It's important that in the whole duration of this project, we had not a single instance of losing the children from treatment. Not a single child lost the follow-up. So we understand how important this is from the feedback. People appreciate what we are doing. And of course, it is inspiring. It motivates us to continue so that we would understand the importance of everything we do. Because every child and every family must feel supported. They shouldn't be left alone with this diagnosis. And our activity and this project prove it again and again, that support, care, support and care are the important factors in the successful completion of treatment. And by investing in the health of our children today, tomorrow, we will definitely have a strong and powerful generation that will continue with our cause. Thank you so much. Thank you. I would like to ask colleagues to join in the conversation. Perhaps you have any questions to the speakers. Perhaps you would like to share your story, something you're proud of. Show your hand. We'll give you the floor. Perhaps it's the only chance to ask a question now, so please don't feel shy if you're ready to ask a question. Go ahead. No one wants. Okay. Then perhaps we'll have more time for the conversation in a less formal environment. Let's say thanks to our speakers. Thank you so much. Indeed, we've heard important stories from the regions, how innovations become the reality, how medical care comes closer to people even in dire circumstances. And we've heard about people who are supporting the patients, the psychologists, the doctors, NGOs. Thank you so much. Let's say thanks to everyone who is providing this support. And feel free to get into the audience. And we are now approaching the moment when we'll have a little break, have some coffee, but I suggest we use this time not just to rest, but to make it useful. And this is the opportunity to visit our demonstration stations, the poster stations. The first one is about the digital solutions for health. There you can test the smart boxes and mobile apps to support the treatment. The second is about the hubs of opportunities, how the training centers here in Lviv and the online platform created by the project, how they operate. And another zone covers screening in communities, digital X-ray technologies, children, and we understand that not everyone can see the work of the projects locally. That's why we brought the solutions here to showcase. So please make sure you find time to visit those. And for the online audience, we have something for you as well. In a moment, I will give you a virtual online tour over some of these demonstrations. So stay with us. Thank you. And we will continue our work upon further announcement. And now, we have a little break.
Так, ну що ж, пані та панове, всі, хто зараз тут вже в нашій
So,
зоні
ladies and gentlemen, if
якраз таки показати, наскільки
you are here with us, you can see these demonstration stations. And we'll start our virtual journey with the first one. This is digital solutions for healthcare. And Volodymyr will brief us about this smart box. And on the tablet, it's the app that I should use. So tell us, please, how do these smart boxes work? How does the app work? What happens when a patient follows the doctor's advice, and what happens if the patient misses an appointment? Now, this electronic module in a smart box is the key, and it has the battery and the SIM card, which can send the signal to the platform over the cell network. When you open this smart box, in which the pills are located, the signal goes to the special platform, and the health worker sees the patient's calendar, this page, where
зелене, це означає, що все
green means the patient opened the box. If the patient doesn't open the box throughout the day, it will be red. And the doctor can do something additional, like making a phone call to the patient, or engaging a social worker, or a nurse to help special app for the video control treatment is also linked to the platform. The patient records a video on their phone using the app. They don't need, so they only need to press one button. The video is uploaded to the system. It is not stored on the patient's device. The patient doesn't need to send the video to the doctor anywhere. So it's just the confirmation that it all happened, right? Yes. And the doctor can watch the video on the platform. Yeah, the list of patients opens at the doctor's side. and they can see if the appropriate dose was taken or not. So these smart boxes, as far as I understand, are something the patients take home, right? Yes. Mhm. They operate at which distance? Anywhere where the cell network is operating. But we've had cases when the patient was living in a really remote village where they didn't have cell coverage, but once a week they would go to a store or they would go somewhere uphill, and then the information which was recorded in this smart box was sent once a week, and the doctor would see it anyway. But then it's the responsibility of the patient, right? Because if the patient is living far from civilization without a cell network, then it's about trust and responsibility. But let's be frank, there are patients who sometimes can find ways to avoid doing this necessary, even when supervised. Are patients using this technology? Well, it's very convenient for patients if video control is not available. Of course, the doctors prefer seeing that the patients take the drug directly, but sometimes we've had cases, for example, when there was a teacher who said she would definitely not be recording videos. That, and then the smart box was really, she was excited for that. Or sometimes the patients just don't have a smartphone, or there are some other technical reasons, like no internet coverage. It still is very convenient as a method of treatment, but once again, we've heard about the AI in radiology. It's an addition to, it is not a substitute for a doctor. So it's a tool that just helps medical worker to focus its efforts on the patients who need more attention. So it helps doctors prioritize and pay attention to the patients who really need. So my understanding is that you see the results of your work, and if you can give us some statistics, how many people are using these smart boxes through the app, and how did it affect the situation? Well, these smart boxes, we started implementing them back in 2018. Back then, we had a pilot project in certain regions of Odessa and Mykolaiv Oblast. We just wanted to see if the technology works at all, if it's acceptable. Then we expanded to 5 regions, and through the project, we would apply this technology in 11 oblasts. Over 5,000 patients have used this technology in this period. Over 600 continue using this technology for treatment, and over 3,500 patients have successful completed treatment. So what's your idea? Like on a grade of 12? Well, it's hard to grade it on a scale, but I think it's very positive because we hear a lot of feedback from the doctors and the patients. And when technologies were available in only 5 oblasts, back then we had the project to pilot the effectiveness of this technology. We've had a lot of requests from medical specialists that, oh, we want these boxes, we want this technology in our region too. I think it's very successful. So the specialists see the usefulness of the technology. But if we compare 2018, when we you introduced that, and now 2025, 7 years passed, are the patients more willing to use it? Yeah, the patients are more willing, and the technology has changed in the meantime. And overall, there is progress in TB treatment, even in terms of the duration of treatments and the number of drugs. And yeah, we've adapted this system. We tried to work with the suppliers to adapt the technology to make sure it's all as comfortable for the patients as possible. Thank you so much. Everything is very clear, Volodymyr. Thank you. So we will continue, and we'll be moving to the next station. It's about the hub of opportunities. We're coming to you. Well, the name problem, it's clear that this hub of opportunities from theory to practice is about opportunities, and it's about the knowledge centers. So let us see what we have here. Who do you teach, and how the training is different from the regular ones? We must know what modern knowledge is, how it should be, and what requirements are. Modern medical specialists must be creative. Creative means what? Creative is being modern, using digital technologies. And the training hub must have a modern professional online platform with the personal accounts of the participants, the trainers, with the expanded administrative opportunities, and our system administrator, Ms. Lafetta, will demonstrate that. So let me give the microphone to Nastya, and she will tell more about the platform. Hi, I can show how our platform is seen by the trainers who take part, and I can demonstrate how the personal account of participants look. I will not be taking you through all the paths of registration. Feel free to scan the QR code. The registration questionnaire is very simple. We have an official website, and you can register. This is how the questionnaire looks. So, for example, we've completed the registration phase, and we are in a personal account. So, usually we do not open all the sections instantly because that is also part of the training. So participants can look at the agenda, then they go section by section. Here we also store links to the Zoom recordings. So if you miss something, you can rewatch it. No, this is a link to an online session. We have online trainings, and also we have homework which can be done at the free time the participants. So something can be done online, something can be done offline. There's a lot of different homework depending on the type of training. You can look at the slides to recap something. Also, we have recordings with the trainer's comments. Also, we can move to the next lecture. Also, we have tests. For example, this is the introductory session, and that's why it has the biggest number of training questions. So it's like a pre-training testing. And for continuous professional development, it's really necessary to compare the knowledge before and after, so that we would see if there was any knowledge gain in this training. Oh, about the testing. Starting back in childhood, I remember that we all are afraid of tests. It's not scary. It's not scary because we just need to know the baseline level of knowledge, and then it's good to make mistakes here because we are actually learning to make less mistakes. And we want to avoid making mistakes again and again. The trainers are sharing everything they need to know. By the way, it's possible to prepare the questions to the trainer for the next session, a clinical case even, and you can get a response from the trainer for a specific clinical case. Also, we have these case studies, and we can type the response. My response is here sent for review. The module usually includes the theoretical part, the video with the comment of the trainers, and the questions for the next session and these case studies. Then we meet the next day and then we recap it all. Any training session covers from 1 to 10 training days, depending on the needs, and every trainer follows the educational progress. So this is like a class log. Yes, we can open any participant and see where exactly they have problems or difficulties. Like this person has failed something, you see? Everything is well visualized, so we see that, for example, this participant is not doing the homework. They might be present in the Zoom training sessions, but unfortunately, they are not doing the homework. And we have the A students, those who do everything. For example, here we see that all the questions are ticked, which means the trainer has verified it all. And if any corrections need to be made, then the participant would see that. So even in my personal account, I can see what is completed, what is not. Like the case study, the clinical study, my response is still being reviewed. So when it's reviewed, if I see a tick, then everything is correct. If there's a cross, it means I made a mistake. So this is how we can track our progress. We also have a feedback form so that we can also improve our work. And well, this is it from me. Perhaps you have some questions. Well, actually, you managed to provide a very thorough explanation. Just one more thing. I love figures. If it's not secret, how many doctors are using these hub opportunities? Oh, that's a question to you. Natalia, I'm coming back to you.
Yeah, and we started our activities thanks to the project Support TB Control efforts in Ukraine, thanks to which we are all here today. And I'm very grateful to Ms. Gunta because as though we were discussing the training activities in Ukraine, I was telling her, look, I have a dream to create the cutting edge online platform, the one they've got in European countries. And I saw ones like that. And she supported this idea. She was not afraid of launching something ambitious like this. And here we are. We had training for TB specialists, and we went beyond. We visited major international conferences, had cooperation not just with physicians, but with non-medical experts. But we are also training nurses and general community of practitioners, physicians, and plenty of trainings where they are conducted for differential diagnostics of lungs-related diseases, also the screening of mental health. And in our plans, we've got to expand to international level, meaning we have an ambitious goal to conduct training of international scale. We have certain agreements with our partners, so maybe in the nearest future, Ukrainian National Training Center, TB Hub, will be well known in every corner of the world. Well, I understand you're doing everything possible for this to happen. So, well, speaking about international cooperation, you, thanks to your activities, communicate a lot and work a lot with international experts from abroad. In what way does it influence us? What kind of outcome? I believe it has got the direct impact because everything starts with training, at least in medical area. Well, but in every other sphere. At first, you need to learn something, you need to master it, to get practical skills, and only then implement it in your daily practice. So, cooperation with international activities, when we are not finding ourselves in a bubble, but rather spreading our knowledge and are borrowing the best practices from abroad, that's a huge platform. And that's a huge platform for development, for improving the health condition of people, for whom or due to whom, thanks to the sake of whom we are conducting and implementing all these efforts. Thank you for this communication and thank you for all your activities. There's a line to talk to you. Everybody wants to talk to you. That's great. As you can see, dear friends, there we have more sites, X-ray, without borders, but we're not going to be still keeping you here with us. We've just tried to show you what's happening here, and we spoke about innovations, something that's already here next to us, helping for the sake of people, working for the sake of people, helping them. And this makes our lives easier and healthier. Thank you so much. Thank you, everyone who stayed online with us. I believe we are going to have a little pause, and in less than an hour, we'll come back to you. You can have some rest, grab a bite, and also maybe even join some projects we've been discussing. Thank you, and see you.
Ну що ж, шановні пані та панове, всі, хто тут, вітаю вас.
So, ladies and gentlemen, welcome back. Welcome everyone who is with us offline and online. I know there are a lot of online participants. Just checked, we have thousands of people joining us today. That's fantastic. Thank you for finding time, and thank you for taking part in this event, at least virtually. So, I suggest we start second part with an interesting game, right? The only thing you need is your mobile phones and your knowledge and your attention throughout this whole event. Now you see a QR code on the screen. Help you to see the code easily, and online participants feel free to join again. You don't need a phone for this. We log into Kahoot service by scanning to QR code or just by typing kahoot.it. Then you only need to invent a nickname, a real name or invented name. I see the first participant already, and feel free to just type the code if you don't have anything to scan the QR code with, and it is going to be fun. And once again, you will not require any special knowledge if you're attentive in the first half of this event. It's going to be easy. Then, we'll play an interesting game. Your cell phones essentially are remote for this game on both large screen here and on your small screen. You will see the options. You will have to select the correct one, and you need to respond fast. So the correctness and the speed of your response will show who is the winner. I think we need to wait for one more minute. There are 63 participants. And well, even in this room, there are more of you here. So once again, talking to our online audience, don't be afraid, join in, even if you play with us remotely. That won't hurt.
Ще, я думаю, потрібно трошечки часу. Вже майже сотня учасників доєдналися
A little
до
bit
нас. Це приємно.
More time. We have 100 participants in this game. It's great.
Та, ну і звісно, коли ви вже зайшли в гру, зараз треба трошки дочекатися, поки всі
And now let's wait for everyone to join.
Часу для цього комусь трошечки менше. Не
It
закривайте
might take more time.
або браузер, в
Don't
якому
close
відкрилася
the
гра.
app or the game open. Even if your phone locks your screen, that is not a problem. But if you close the page, then you're out. So stay online. So
Бачу, що тут, в принципі, у нас уже практично 100% готовність у
I see that we are almost 100% ready here. I hope our online participants also were able to join. So let's wait for 15 more seconds and then we will start.
Ім'я. Ну що, давайте. 10,
So 10,
9,
9, 8, 7, 6, 5, 4, 3, 2, 1. Let us start again. Let me remind you that we need your attention, correct answers, and speed. That's the only thing we need. I suggest we start. Let us start the game. Attention. We'll now see the screens on both the questions on our screen and on your screens. The game starts. The first question. How many regions of Ukraine have been covered by the project in the beginning of its implementation in 2019? Red, 3, blue, 12, yellow, 24, green, all the regions. Pick your response. You have 15 seconds. I see the answers coming in. You got the essence. You understand that you have to respond fastly. 5 more minutes respond to this. Okay. We have split opinions. So you see that 35 participants think so. Only 3 regions, but 58 think there's 12 regions, and that is the correct answer. 24. That was in the beginning of the implementation. So bravo to those who gave the correct answer. And then we can see that Volodya is leading. Volodya, Olga, Olena, and OE.
В першій п'ятірці лідерів, але знову ж таки максимальна концентрація. Ми
So
переходимо до
once again, we have maximum concentration, and then we get to the second question.
Що означає
What
RIS?
does
Регіональна інспекційна служба
RIS,
червоний. Дуже цікаві
the Regional
речі.
Inspection Service, red?
Жовтий випадково
There are interesting
можливо
things.
термін. Зелений радіологічна
And then
інформаційна
Radiological Information System.
Трошечки більше 15 секунд.
And there are 15
Не знав
seconds to
відповіді
figure
до
this
цього
out. If
моменту.
you don't know the response to this question.
Ще 10. Майже сотня відповідей у нас уже є.
Almost 100 answers already here.
Час вичерпано.
We won.
Ну, регіональна інспекційна служба
So
трошки
the
збила. 12
Regional Inspection Service confused 12 players.
Скорочений термін, так вирішили обрати.
Two even think that it's a reduced term, but the 81 correct answer show that it's the Radiological Information System.
Розібралися. Отже, після другого запитання маємо такі зміни.
Then
Володя все ж таки
we have a
тримається.
change in our leaderboard. Volodya is leading that. Olga O
тримається в трійці.
is the leading. Mikatenko comes up here, and
Так, у нас
Julksa
або п'ятий, так?
is
Ну,
fifth.
розумієте, все стрімко змінюється і стрімко
So things
переходимо
change
до
rapidly.
третього запитання.
Now let's get back to question 3.
Скільки людей пройшли тестування?
How many people have been tested by quantifying the Gold QFT through the engagement of the private sector supported by the project?
1000 червоний,
1,000 red, 10,000 blue, 100,000 yellow,
відважних
and
зелений.
10 bravest is green.
Скільки
Think
могло
well.
ж це бути людей?
How many people could be
Є ще
tested?
трошки більше 10 секунд, щоб
We
дати
have
свій варіант
slightly
відповіді.
over 10 seconds to
Іноді краще там на декілька
respond.
секунд затриматися в роздумах, але дати правильну відповідь.
It's better to
Втратити
take
всі
longer,
бали,
but to
які
give a
можна
correct
заробити.
answer
Отже,
than
час
losing all
вичерпано.
the points.
Ну,
So
знову
the
ж таки, так?
time's out.
11 за 1000.
11
за
voted for
100 000.
1,000, 9 for
Віримо,
100,000.
так? Хтось один все ж таки
One
лише 10 відважних, так? Ну, і абсолютно більшість
voted
дає
for the
правильну
10
відповідь.
best.
10 тисяч.
Majority gave the correct answer 10,000.
Тобто
It's
понад
10,000
10
plus, so
І дякую
over
за те, що ви
10,000.
безпосередньо
So thank you
маєте
for
до цього відношення.
being
Що
directly
в турнірній?
engaged
Що в
in this.
турнірній таблиці?
What's on the leaderboard?
Ольга, ой, Володя тримають лідерство.
Olga O and Volodya keep the leadership.
Ірочка
Joksa is at the third place, and we have two new participants
Прямуємо далі.
in the
Наступне
leaderboard.
запитання.
Let's proceed. The next
Що
question.
таке пункт доступу до
What is
медичних
the
послуг? Кав'ярня з
healthcare
безкоштовним
access
Wi-Fi.
point?
Червоний.
A
Громадські
hospital
простори
with
для
free
охорони
Wi-Fi,
синій.
a public
Нова
space
комп'ютерна
for
гра.
stream,
Жовтий.
new computer game,
Зелений.
and a bus stop.
Максимально спростили вам варіанти.
Yeah, the options are quite trivial.
Ще є 10 секунд.
10 seconds to respond.
Ну, мені здається, що не вистачає лише
Well,
пунктів.
I
Все вище
think-
перераховане, так?
We only need all of the above option here.
Все, час вичерпано. Ну тут абсолютно
Okay, here we have the absolute result. 100%. The players give a correct answer. Of course, it's a public space for the medical screening services. Thank you. The leaderboard after this round saw some change. Volodya regains the top position. I think everyone now votes for Volodya. Juksa is on the second position, and you see the remaining leaderboard.
Наступне запитання.
And now the next question.
Який інноваційний тест?
Which
Проєкт
innovative
запровадив
test
для діагностики
has been
ТБ
implemented by the project to diagnose TB in children?
дослідження калу? Червоний.
That is two sample we have. Eye color test, blue. The cookie test, yellow. Or the song contest, green.
15 секунд є на те, щоб дати відповідь.
You have 15 seconds to respond.
Ще 10.
10 more seconds.
3, 2, 1. Час
3,
вичерпано.
2, 1, time's out.
Що, тест за кольором очей все ж
So
таки
the
5
eye color test
учасників
has
заманив.
confused
до
5
себе. Я
participants.
думаю, що все може бути.
I think anything can happen, right?
Інновації ж вони такі, вони розвиваються
Innovations
дуже
are
стрімко.
really developing
Тест очей з
fast.
передбаченням для двох.
So
Це ті твої
the cookie
учасники, які
test,
завжди
two.
вибирають найцікавіші варіанти.
Well, I think these are the two participants who always vote for the most interesting option. But the 96% voted correctly, but it's a still sample.
Це Володя, Юльця
The
тримається,
leaderboard.
Юльчка К виривається на третю, Ольга четверта, Ольга О,
Anna
і
is the
Ганна
fourth,
п'ята сходинка. Тобто
and
вона
Hannah is the
стала
fifth.
топ-5.
So we have
Але є
more or
ще декілька
less
запитань, і знову ж таки все може
stable
змінитися. Прямуємо далі.
participation there. Let's proceed.
Найкращий підхід для
The
своєчасного
best
виявлення
approach for the
туберкульозу.
timely detection of TB
Проводити
is
обов'язкові огляди. Червоний.
mandatory examinations,
Тими, хто
red,
сам звернувся за
working only with those who come for medical care on their own, bringing the healthcare services closer to people, and the green one is identifying people with TB through horoscopes. Think for 10 seconds.
3, 2, 1. Час вичерпано. Я
One
бачу, що
time's
всі
out.
встигли розібратися і дати відповіді. Так,
I
але тим не
see
менше,
that
39 з вас вважають, що
39 out of you think that the mandatory examinations, well, in this context, the best approach for the timely detection of TB is bringing the services closer to people. And 59 of you gave the correct response. Bravo. Let's look at the leaderboard. We have some serious changes.
Юльця тримається на другій, Ганна
And,
виходить на третю, Гунта з'являється.
Volodya, Gunta is in top 5 for the first time.
І Ольга
On
1978.
impression 6 and Olga 1978 is getting back to the top 5. Let's continue.
Який із наведених варіантів
Which
допоможе
are the
подолати туберкульоз?
Options would
Розвиток
help
спроможності
overcome
медичних
TB.
працівників
The development of capacity for medical workers in treating TB, red. The integration of innovative technologies in healthcare practice, blue. Patient-first approach in support, yellow. All of the above, green.
10 секунд.
10 seconds.
Час вичерпано.
Time's up. 85 will get a correct response because all of the above indeed is the correct option. We can be certain that all of the options indeed are correct and they will help overcome TB. Thank you for this round. And now leaderboard, we have stability. Volodya, Hanna, Yulka is third, Hunter is fourth. Slava is for the first time in the leaderboard. We have 2 more rounds, so pay attention, things might change again. Which of these options is not needed for the prevention of TB? Access to diagnostic tools to detect TB, red. Knowledge of symptoms and the course of TB, blue. Access to medical services, yellow. Isolation from the environment and people around is green.
Є ще 10 секунд.
We've got 10 seconds.
Все ж таки важливо в цій грі.
Attention matters in this game. 5 seconds.
Час вичерпано і
Time's
знову
up.
абсолютна більшість з вас вибирають
And the majority selected the correct answer. The isolation from the environment and the people that is not needed for the prevention. But these 11 people who responded different, they were just joking. So before the last round, in our leaderboard, we have this table 3. Volodya, Hanna, Yulka, Slava in 4th position, and Daria enters the top 5. So the final decisive round.
Скільки років офіційно триває проєкт?
For how many years
Червоний
does the project last officially? 3 years, red 6 years, blue 9 years, yellow and eternity.
звісно, зелений.
And it feels like green.
15 секунд.
15 seconds.
Тут, звісно, може бути тут дуже суб'єктивна відповідь у кожного, так?
Of course, the responses might be very subjective, but there's one true response. So time's out. 6 years, of course. The majority gives the correct response, even though I think some of you might have answered the alternative. So, ladies and gentlemen, we have completed this nice game. It's time to learn who the winners are.
Наш п'єдестал. Третя сходинка.
Hall of Fame. Third place, Volodya.
Друга сходинка. Юлька.
Second place, Yulka.
І перше місце
And the first place,
Ганна.
Hanna.
Якщо ви в залі, ну і щоб ви
If
розуміли,
you are in the well, Slava is the first and there is.
Ганна, просто
If
взнайте, щоб вам
you are in this room, just stand up and I'll give you the round of applause.
Дякую вам за активність.
Thank you so much for being active in this game.
Переживав, як за себе,
Володя.
звісно, ви ж розумієте, так? Але
Well, that was exciting, right? But
пустили вперед прекрасних пар.
you just let the ladies go first. Thank you so much.
Давайте повертатися до робочої частини.
So now let's get back to the part when we discuss the innovations, and now it's time to look at the daily practices that keep the healthcare system sustainable. And this discussion will be dedicated to the community-based screen that helps timely detect TB and non-communicable diseases. We will go into different topics, including the young mothers, because the psychological condition in the perinatal period can be a risk to develop TB. And we'll talk about the innovations in IPC and the nurses whose role in condition safety becomes more and more important. So we get back to the second discussion. You see, and it has the name, the resilience of systems from screening, prevention and leadership. And I invite the participants, the panelists. Roman Rodina, the manager on IPC. Галина Дараган, project programming specialist.
Natalia Zaika,
the project manager on mental health and social development. And Hanna Червона, the director of the Kyiv Vocational Medical College, named after her birth. So welcome, panelists. Thank you for being with us. So, Roman, let's start with you. You've got the mic, you've got the clicker, water, applauses, everything it takes for this work. So, Roman, let's start with the following. How did you come up with the idea to create these screening points for the early detection of non-communicable diseases? And why are they important for communities? Well, the idea for this screening came up in 2022 when the project reoriented our activities with the beginning of the full-scale war, and there we were helping the IDPs. There were a lot of them, and there were a lot of locations for the IDPs where they were accommodated, and we helped vaccinate them. But the idea was the following: if the team goes out to vaccinate, then why wouldn't we also do some screening for the non-communicable disease? Because everyone had been stressed, and well, stress is a risk factor. The development of many diseases such as hypertension, diabetes, and so on. So back then we started doing the screening in the locations where it was hosted, and then we caught up with this idea because access to healthcare is limited in poor, and we decided to help to the health system by organizing the community screening points. So trying to bring help closer. I think even in the quiz, it was the question. So we decided to bring care, not the treatment care, but the preventive care closer, because identifying hypertension in early stages is very useful. Because people might have high blood pressure, and they would not know about this until a stroke or a cardiac infarction starts, and then it puts extra load, extra burden on the health system. And you know how hard it is for the health sector. Some outpatient clinics were destroyed. So it's in liberated communities and in communities where there were a lot of IDPs, we've organized these screening points, and we started doing this screening. The screening actually is already mandated by the legislation. There is the order for the primary health service, and we decided to support them, to engage the communities. Why the communities? We tried to engage the non-medical workers so that the communities who want the residents to be good health, so that the communities would properly establish the communication with the local residents, let them know, so the locals would come and get this health check, because it's free of charge for them. What were the results? We will be presenting them further. And in terms of work organization, the project manager, Halina, is responsible for that. She knows everything. She knows more than me about the screening points. And locally, we have people who are there. Some have even been organized in non-medical facilities, like in libraries or centers for digital services, in places where they wanted to support this initiative. Halina, now over to you. Can you please tell us about the result that you already see? Do people actually come to the screening points, and how does it affect the health of people in communities? What was the reception? Thank you. Hi once again. Indeed, this is the work of the whole big team of the project. and it's a great pleasure for me to present the results. I would like to say that, oh, sorry, a second, to stop. So that you would see the statistics. We work in 11 oblasts in 13 communities, and we've opened 234 screening points. 45 of them are in non-medical facilities, as among staff. You can check the photos, and with our team, we visited almost every screening point in all the communities, and these were different organizations, clubs, even social services or employment services. And these are people without medical education, the lawyers or engineers who work there. They were just local activists and they were engaged in this work. In terms of the results, I would like to say that we received quite impressive results. We did the screening to 105,000 people, and this is the achievement of our big team. And the results impressed us a lot because, well, you can see it on the slide, which communities were there, and you know each other because you visited each other, your friends, and you can see the results that 1/3 of people who underwent screening had increased blood pressure. Almost 15,000 people had high glucose level and cholesterol above the norm. Talking about the BMI, if you attended our station, we have this device for the BMI measurement. I don't like this indicator as such because, well, it just represents our life. And it represents how we live, how we eat, but there is the STEPS study, it's been conducted by the WHO. The figure was 56%. We unfortunately got 70%. This shows that there's a lot to do. There's a lot of things to be done so that people would change their habits. Talking about the ancestry, I would like to say that we also got some impressive results. Unfortunately, a lot of rural areas do not have the possibility to timely undergo cancer screening. And, let me get back. And we did this survey. We don't have the opportunity to use the tools for this screening in villages because it's not in line with the legislation. But we did the questionnaire whether people had any risk factors for some types of cancer. And 1 out of 4 or 1 out of 5 people had several risk factors or even symptoms, and then they should have been tested in a health facility. So in our program, we were provided the possibility of tracking patients to ensure the timely diagnosis. Because now you understand, a person comes, the person gets the news, nothing hurts, and the person would probably not go to a doctor if they don't have any complaint. But the project supported this innovation. All the screening points have laptops, and community nurses have been trained. They have access points, they have access keys to the e-health system, and right in the screening station, the data was input into the health system, and then the doctors would be able to timely diagnose the patients. We've achieved good results with that. And a nurse who is somewhere in a village who previously they would need to go and ask the patient if they contacted the doctor. Now the nurse sees if there has been a doctor's appointment or not, and now even the starostas, the older persons, are engaged in the process. First, they didn't understand why they might be engaged for this initiative, but then they underwent training, and I want to go back to this slide. And now the screening works systematically. Initially, I wanted to stop on the first 4, wanted to refer, and then it would be up to the health system. But then we understood that it's difficult for rural areas. That's why we've selected this approach for tracking. And now all the people who undergo screening, they're referred to a doctor, they are diagnosed quickly, and then they receive the appropriate treatment and early stages. Thank you. Thank you. Fantastic work and fantastic result. It's definitely worth applause. Indeed. And you've been leading to my next question. Could you please show this slide again? I understand that every screening is, it has some story behind. But from your personal experience, can you tell a story when a screening literally saved a life? Thank you for the question. I like this question, but there's not much time to tell all the stories. But there are a few bright examples I really would like to share with the audience to show that. Well, let me start. I'm a bit anxious because I am a doctor epidemiologist, and my objective has always been prevention. So I've been dealing with infectious disease, and this is non-communicable diseases, and the result is so great that I really want to share it.
So the first case is about this young woman. Oh, sorry, I went a bit too far in the presentation. Let's go back a bit. Yeah. Ms. Barbara, we are very grateful that she agreed for us to present her story. She is 58. This is Reshetilivka community, Poltava region. She underwent screening at the screening site, and they identified the high level of sugar and suspected oncology. Thanks to the actions of nurses, she was referred to doctor really speedily, and the uterus body sarcoma was the diagnosis. She's undergoing the course of chemotherapy. She's getting treatment of diabetes mellitus, and she has an opportunity to continue on with her life, and the forecast is positive. Now, yet another case, a woman, 47, actually two women, 47, they were refusing to undergo screening. They had no complaints, so it's very difficult to persuade people with no complaints to go to doctor. As far as we feel ourselves okay, we don't go to doctors. She said yes, eventually, and they identified the risk of the oncological disease, and they've identified the first stage. That's very rare in our country that we can identify cancer at stage 1. So she underwent surgery, and the forecast was great. Yet another woman, 47, a Zviagel community, she was saying, no, I don't need any screening, but in the village, people are passing information to others very swiftly, and she wanted to try. So the glucose was very high. It was unexpected for her. She believed to be completely healthy. The family doctor prescribed medicines, advised on changing the lifestyle, and now she is already motivating all the residents of the village to go and get the screening, even if they don't have the complaints. This is a very vivid example. And the final one I would like to share with you would be a very interesting one. We were visiting this community with Roman when the nurse shared this experience. So the screening really saved life of a young man, 19 years of age. He had suicidal thoughts, and he came to the screening. He was down the weather. He had insomnia. He was depressed, but the nurse managed to start talking to him. According to the HQ9 questionnaire, the stage of the depression was really high. He was sent to mental health clinic. He was treated successfully there. Now he is active, he's optimistic, and he's very grateful that actually his life changed. And parents are very happy that the life of their son got changed for better thanks to this very screening in this village. Thank you. Thank you, Ms. Halina. Such stories inspire, right? You inspire physicians, patients, and the story of this woman actually is really inspiring, like urging others to go and get screening. Very nice. The word of mouth, it works. Thank you. And Miss Natalia, so within the framework of regaining access to medical assistance in two communities, you've introduced the algorithm of supporting pregnant women and young mothers. Could you tell us in what way it all works, especially in the conditions of work, and what are these resilience rooms? Thank you for this question. Greetings, dear colleagues. I believe that among you there are plenty of people who think alike. So, really, the logics of resuming with medical assistance stipulates for selecting those people who require the assistance most urgently. So, we understood the pregnant women and young mothers would be that category of people who, in our country, really have got one of the greatest loads, both physical and mental, among civilians. I would like to draw your attention to the fact that the period of pregnancy is the period of really psychological and physical load on any woman. And we all understand, we all know that a woman in this period has got an elevated risk of contracting infectious diseases, including TB. And we pay attention to TB diagnostics among pregnant women and young mothers. And in the recent years, we started paying more attention to the psychological condition of pregnant women and young mothers during pregnancy and during the first year after delivery. For these women, we offer certain services because they undergo very stressful period with significant changes in their life, and even women with a high level of income, still we see plenty of women with perinatal depression. In countries with the low level of income, we see that the share of women with postnatal depression is even higher. So a woman who dares to give birth to a child in times of war looks like a real hero to us, and that is why we decided to offer an approach which, from the viewpoint of a woman, would be convenient. This was meant to be a comprehensive approach, and we wanted a woman to be getting the services right at the very same institution where they are getting all the pregnancy-related assistance and delivery labor-related assistance. So a pregnant woman would never travel to the other end of the city or beyond for mental health services. We decided it should be a screening because not always a pregnant woman, a young mother, understand what's happening to them. Quite often, women don't sleep, have got insomnia, anxiety, have some depressive thoughts, but they think this is just fatigue and it will pass and everything will get better, but it doesn't get better on its own. And this influences the condition of the child as well and the whole family, the well-being of the family. So the screening is needed. Who is conducting this screening? Well, this would be something that some services that are close not to the place of residence of woman, but to the place where the woman is getting medical services, where women go and get observed in the course of their pregnancy. And also such offices are located close to the pediatrician offices because women often go to pediatricians. Actually, we are very interested in supporting women within 1 year after she gave birth. So we are involving experts who are helping us out to conduct this perinatal depression screening. So the screening stipulates for identifying those people who really need, who require specialized assistance, or just psychological, emotional, social support. And what's important about this? Maybe you paid attention. We speak about support. We speak about friendly spaces. And let me tell you the truth that a friendly space cannot be created without the involvement of NGOs. Because, NGOs are investing real love into creating these safe spaces, friendly spaces for mothers, for children, etc. Well, they are really great. I don't think healthcare providers have got time and resources to create spaces like this. So I would like to draw your attention to the fact what kind of an arrangement we have here on the video. And the Revived Ukraine NGO helped creating this very space and 100% live. Also helped us with this just amazing spaces. You can see everything is present here. A place to breastfeed, a place to change the diaper, very convenient chairs that are convenient for pregnant women, even if they are going through their final trimester when they are heavily pregnant. And you can see these beautiful pictures on the screens for mothers to feel pleasantly. And there are places to conduct individual consultations and also some to just sit and communicate in this friendly atmosphere, bring children from school here. So the key services provided in these spaces would be training, the issues of taking good care of newborns, early development of young children, then support groups where women communicate with each other, they share some issues they might be facing, they also sharing their success stories. And I strongly hope this is going to be multiplied and scaled up in Ukraine. This is something well needed. For sure, there's a psychologist who is selected by an NGO, and the psychologists work. They know all the approaches and techniques how to support pregnant women. And the social worker is also present here, who are identifying the need for social support, who can actually refer a person to any other specialized social services. In total, we've been introducing this program for less than a year. 356 women were screened within this time, 116 required assistance of various kinds. And we can say that 116 children were born next to happy mothers. We believe that that's of paramount importance, especially to being inspired to start a life properly. And actually, this is done for the healthcare providers to pay more attention to the mental health of pregnant women. Thank you so much. And especially thank you for this warmth with which you speak about this very project. I would like to hear yet another example, Ms. Natalia, in what way the route is arranged. Okay, screening is conducted by gynecologists in the course of a woman's pregnancy, in accordance with the protocol of pregnancy maintenance. Previously, the physicians were using the other scale and they didn't know where to send the results. Sometimes they were just mentioning, well, we would advise you to talk to psychologists, but now women are referred to these resilience rooms. After the delivery of a baby within a year, a woman is observed either by the pediatrician or family doctor, and both doctors were covered with the training on the peculiarities of all the support which is needed by pregnant women, future mothers, and mothers within the first year after they delivered their babies. And whenever there are symptoms of anxiety, trauma, depression, women are referred to the resilience rooms. in these rooms, assistance is provided to those pregnant women who can be getting assistance from the social workers or psychologists. But whenever there's already a manifested significant depression, then a woman will be addressed to a psychiatrist. And in this case, a woman will not be standing in a long line, but will get the referral. Thank you. Okay. Oh, that's easily very interesting. Could you advise the other communities what can help scaling up this process of this approach? Well, to tell you the truth, this model needs to be further developed, improved, and in order to scale it up, what is needed? Our legislation does not prohibit us from doing so. Vice versa, screening is very in demand nowadays in our country. This is the service that is well needed. If we speak about community, and this is the place such assistance is well needed, then political will is necessary. It was quite easy to talk to the heads of the communities, mayors, council heads. They are eager to cooperate with us. If we speak about where to get money, we have NGOs, we have civil society, and we can actually rely on their support as well as on the support of international community, because this topic is, so to say, not fully covered at the level of the country. This is something that requires extra efforts, additional attention. So in order to scale it up, for sure, we need more trainings. Actually, this time we conducted 3 days trainings. That was enough for doctors to understand all the needs. And we involve social workers and psychologists. I would offer using the resources of NGOs, because I don't know whether there is something impossible for our volunteers and NGOs. Whenever something's needed, they are there, ready to bridge that gap. As for sure, we need to agree the plan, conduct the monitoring, have a look how many women were covered with screening, whether they were all referred and linked to care. This is a teamwork, and this is the cooperation which yields great results as we see this. You feel great when you implement it. There were women with quite complicated pregnancies. They had symptoms of depression and anxiety, and psychologists managed to cope with the symptoms, and women gave birth to healthy children, and they were happy and satisfied. We have women who actually had to get displaced because the houses around them were destroyed. And, quite often this is the situation when the father is a defender, a woman is home alone, and she's worried about her husband. She feels anxiety. So yeah, that's a great opportunity for her to talk to psychologists. It improves her quality of life. She's concentrated not on the grief, if God forbid father dies in war, but on the development of a child. There are plenty of examples like this, and this is something very promising, I should tell you. Apart from this, if we speak about TB, you can ask, well, in what way this is related to TB if we speak about perinatal depression. Oh, let me tell you that we speak a lot about multi-sectoral approach. Multi-sectoral approach at the level of the state is clear, like ministries, institutions get together. But at the level of community, it means what? The offices of NGOs get together, civil society organizations join their efforts with medical institutions, with social support institutions in order to provide assistance to this woman. And the patient-friendly spaces can also be linked to other healthcare programs. For example, we can add TB screening here. Well, I can't tell you this is easy to bring it all in one spot. A lot has to be taken into account. But there's this good basis where you can do this. If we speak about services for women in time of their pregnancy and after delivery, then TB trainings, TB screening can be offered, influence of the woman to the members of their families, and she'll go back home and she will discuss home what she heard at this support group or this training. And actually, these are those issues which help us providing high quality preventative services, including on TB.
Так, дякую вам надзвичайно.
Thank you so much. Help me out here.
Ганно, ви так взялися за
You know, I'm going to come back to you. I just want to go back to Mr. Roman real quick. I didn't forget about you, no worries. Mr. Roman, how do you combine prevention of infectious and infectious control with trainings delivered to children and adolescents? Okay, let me start afar a little bit. Everybody knows about such a problem as actually resilient bacteria to antibiotics. All these microorganisms are really resistant to antibiotics. We treat it with antibiotics, but it's not active. The world knows that if the problem like this will be developing as it's developing now, then in 2050, it will be a problem to treat even the simplest infection because all the microorganisms are going to be resistant to antibiotics. In what way it's happening? Well, you get a flu, you get a viral infection, you go to the pharmacy, you buy antibiotics, but it's not active in this case. It won't yield you any results. So we decided to start educating children. They train us, they teach us to wash our hands as we are still little kids. Some elementary hygiene habits. So we've analyzed in what way they deal with this issue in the world, how to convey this message to children that non-controlled consumption of antibiotics is a serious threat to humanity. We decided to really start with children rather than adults, but they're kids, which is why we have to offer some playful formats. In Lviv region, there is a Horodok community, and this community was selected by us in order to pilot an awareness-raising campaign on the rational use of antibiotics among school children. Because this community was interested in participating in a project like this, we are very grateful to the leaders of the community. We selected 2 schools where we were conducting certain events. So, in the first place, there was the training for teachers because they have the fundamentals of health subject at school, and they said, we will deliver this message to school children, but train us first. So we conducted this training for teachers, and we've analyzed the global experience. So what would be the best way to sell this idea? So actually visualization kicks in as something very fruitful. With the support of the community at one of Horodok school, we've created a mural like this. And you could again ask where the antibiotics are here. But you know, the problems of antibiotics would be just one part of the problem. And the essence of this mural would be if you have problems with health, you need to go to a treating physician, not to be treating yourself on your own, not to go to the pharmacy and buy anything. The antibiotics cannot be bought without prescription, but it depends on the situation. And this mural is visible to everybody crossing the city. So the main message here would be that you need to solve your health problems addressing your treating physician. But we didn't stop on this solely. And we have analyzed, once again, this global experience in order to understand in what way they conduct similar awareness-raising campaigns. for elementary school children. We had a competition of children's drawings on the topic of antibiotics. So have a look. These are all the pictures, all the drawings, but you can see, we haven't selected the winner yet, but this is about antimicrobial resistance. As I said, this would be school children starting from grade 4 to grade 7. And this is how they see this problem. And then this drawing to the left, well, antibiotic is kicking the virus, and the score is 30-0, but the virus is still alive. Why? Because antibiotics are not active against viruses, and school children already understand that. So we decided this would be a great approach, and this way they can get certain prizes. And also, we are going to come and deliver appropriate talks at the fundamentals of health subject lessons. We will discuss this problem there as well. So I believe if we start talking about this with children, the issue of antimicrobial resistance, it will be solved. And when this child goes to a pharmacy with mother or father and will hear that the adults are buying the antibiotics, and our ultimate goal would be for this child to say, "Mother, father, at school they told me you can't be just buying antibiotics for yourself at your own discretion. Go to the hospital." Thank you. I really loved that antibiotic was depicted as blue and yellow. See, well, the children have got great associations. They understand that antibiotics are there to improve our lives, and they associate it with something great, with our life. Okay, Mr. Still talking to you about prevention of infectious diseases at the level of a healthcare facility. What do you think? Why shall this be a priority in the activities of a healthcare institution? And what was done by the project in this regard? Thank you for this question. Well, let us just imagine this situation. A person is admitted to the hospital and the person is getting treated. Therefore, one disease they came with. All of a sudden, in the hospital, yet another comorbidity joins the pathogen of which is circulating in the hospital. Unfortunately, it can be a real life situation. It can be transferred on somebody's hands and the equipment. Then the physician shall be treating yet another disease which was acquired at the hospital. This is yet additional load on the healthcare system, emotional load on the patient, and the time spent at the hospital will get extended, and the state is not going to pay extra for that because the state is paying for treating the underlying disease, the initial disease. So why am I speaking about this? There's this prevention of infections and infectious control. This is something really easy. This is the set of measures that help preventing this comorbidity to join the initial cause of getting admitted to the hospital. This is called hospital-acquired infection, and all the experts know this word combination. In order to solve this problem, at least at the level of one or two institutions, our project decided to help hospitals and actually learn how to identify these hospital-acquired diseases. The thing is that, unfortunately, identification of such diseases is quite complicated in Ukraine, but there are these special tests. There are these special researches that say that every 7th to 10th hospitalization end up in getting some additional, contracting some additional disease. So actually, we are working with one healthcare institution, and we plan to join yet the other one. And we want experts to know how to identify the possibility of the hospital-acquired diseases. Back in Soviet Union, it was a very huge problem if the hospital-acquired disease was identified, which is why they just turned a blind eye to that, and that's it. Now we are very conscious, and we are eager to implement all the possible measures. Yes, it's difficult, but if not to start doing that, then we will never succeed. So there are certain plans also to introduce certain infectious control measures. That's hand hygiene, and also a rational prescription and correct prescription of antibiotics. So we work with several institutions, but also we decided to have this other approach because it's very difficult to cover actually dozens of thousands of healthcare institutions, and that's not the primary task of the project, but we are ready to work with those who has to deliver this message to the hospitals, and this would be regional CDCs. So in 2023, the infectious control departments were created. The majority of infectious control departments leaders are here in this room. I'm very grateful to you that we've managed to introduce something like this. So starting from 2023, we've conducted plenty of trainings and workshops. And this is one of the trainings, by the way, you see on the screen, where we were dealing with ultraviolet lamp, and its efficiency has to be assessed. If it's just on, it doesn't mean yet anything. We've procured all the necessary equipment, and we continue these activities. And now let us have a look how it all started. Oh, let's go back to 2023. As the infectious control units were just created, we are going to have a video now, and let us have a look and think back about it.
The project supporting the efforts to combat TB in Ukraine, implemented by PATH with the financial support of the USAID, is developing the potential of the regional centers for disease prevention and control, and provides the needs of health facilities to help them quickly recover. This series of training sessions is needed to teach the specialists of the CDCP the practical skills required in the regions, in the health facilities, at primary, secondary level, and specialized facilities, and that includes the TB clinics. Our organization continues to continue the provision of the support and training sessions and practical visits to health facilities. The professional school on the foundations of monitoring of IPC has been conducted in Dnipro for the 25 heads of infectious disease prevention and control who undergo the training as part of the PATH project in partnership with the Center for Public Health of the MOH. The prevention of infections and infection control are only being implemented in Ukraine. The leading role here would be played by the IPC units of CDCP. The Public Health Center would like to appreciate PATH and USAID for the possibility to conduct practical training sessions for the specialists of IPC units at CDCP. The school would improve the knowledge of the specialists of IPC units of CDCP so that they would be up to date about the infection prevention and control best practices and the measures to ensure IPC over TB at national and regional level. The school's participants will learn the risks of the spread of healthcare-associated diseases, and they would be able to properly organize waste management. Thank you. The training sessions continue because this is an ongoing process. Because some people have left the units, but the team remains. And we would like to say thank you for being here, for working with us, especially in the situation of the war. It is very strong, and our health facilities will be improving in terms of infection prevention and control. So it's about even proper ventilation. By the way, we've procured the expensive equipment for the CTCPs, and it's an independent test, the quantitative test that helps you to provide objective assessment of the respirators which people use in different high-risk zones, whether the respirator fits the face. So we provide a lot of knowledge, and now well, the heads of IPC units of CDCPs know this already, that all this knowledge is already uploaded to the YouTube channel, which will be launched soon, and this YouTube channel is called IPC People. So it's for the professionals, and not only the professionals, because we want to share this information. It's free of charge, and now let's watch a promo reel. Welcome to IPC People. This is a place where the leading specialists share their experience in infection prevention and control. How do we identify the IPC people? They have mastered hand hygiene techniques. They know all the sections of the Order 1614, and they master all the infection risks and their mitigation. So let's build IPC units together. So stay tuned, follow, like, share, and we hope we'll have a lively discussion, and many questions will come up, and hopefully this resource will help us cover as many specialists as possible, because the project unfortunately has a limited capacity. We cannot train everyone, but this would help everyone get trained. And of course, we are not sitting idly. We promote modern technologies, and this is going to be very useful, because indeed things develop, things improve, and if it's something interactive, if it's something gamified, it's going to be interesting. That is why we started our second part with the game, so that we could show that one can study and one can check their knowledge in an interactive and fun format. Could you please tell which digital technologies do you use in training? Let us just watch this video and you will see what we are using. Regular training sessions and practical training is one of the mandatory components of the multimodal strategy in hand hygiene implementation in health facilities. In order to make this process more interesting, we use different formats of studies, including one that uses modern technologies. For example, we use virtual reality technologies or VR technologies. This helps us processing the skills and training the skills in an interactive environment. This will help improve the adherence of the personnel to training. We need to have a laptop, licensed software, and a VR headset for this. The technology lets us dive into a virtual department of a health facilities. We can go into a ward where the patients are located, and we need to do some tasks. We can do the auscultation of the heart or check the temperature of a patient through this special thermometer. Everything we did, we record in the patient chart, and in our work we must always follow hand hygiene rules. That's why there are antiseptic dispensers so that we would be able to properly do hand hygiene according to the indications. This training is special because we have different environments. We can visualize patient zones, or we can saw how microorganisms are spread inside the health facility. For example, when we contact the patient, we would bring some microorganism onto our hands. And if we do not follow hand hygiene, then we can take the microorganism to another patient. So our hands become effective for the cross-contamination. And if we don't follow the rules, we can infect our patient, infect ourselves, or we can spread the pathogens in the health facility. That is why following hands hygiene practices is an important step which can help us break this chain of cross-contamination in health facilities. At the end of every session, we have the possibility to analyze our work, to see our mistakes, and to take some conclusions so that in the future we will not repeat them in real work. There are different options for the trainings, and it depends on the characteristics. You can choose a different option that fits your requirements. And of course, it's not the full substitute to real workplace training, but it probably would add some fun and would help attract the staff to training. I think when doctors or nurses would start using the technology, they will learn to properly do hand hygiene because it is very educative. And it's really for the wide range of medical personnel, including the nurses, and we'll continue doing the training sessions. Thank you. It's very up-to-date, it's very interesting, and it reminds some favorite computer games. We all experienced that, right? So I think for younger generations, especially, it would be very interesting to study this way. Now over to you, Hanna. What was the project result that your college implemented? Thank you, Timur. Before I tell about the project in which our college took part, I also want to provide some feedback on what Roman said. As an educator, I think it's ingenious to form proper antibiotic, antimicrobial stewardship practices from preschool and school age, right? And VR glasses, well, I hope someday in our college we'll have that technology. So, talking about the project, over 20 years, for over 20 years of my life, I've been supporting the nurses in their training at pre-graduate and postgraduate level. And in this path as an educator, it was the first project which had 3 components, which, in terms of scale, usefulness and effectiveness, and ultimate result, probably was the biggest in terms of scale. And I'm proud of our college to take part in it. Firstly, we developed the curriculum. The curriculum for IPC, 180 academic hours. The curriculum was fully supported with lecture materials, slides, case studies, videos, skill, algorithm. This program was done by nurses for other nurses, and I'm also proud of that. The nurses were the leaders in IPC. The second step of the project was its piloting by a team of teachers of medical colleges and the specialists of IPC from CDCPs. This was Roman's idea. I didn't like that idea. But when I saw how it actually works, when theoretical experience, academic approach, and field experience, practical experience, well, it all gave us feedback fast, and we would change the academic content on the way. The pilot lasted for 3 months. We had online sessions and we had practical training in Uzhgorod, in Ivano-Frankivsk, and in Kiev. So now you see the pictures how we worked in Ivano-Frankivsk Regional Hospital. And they are a leader in this implementation. And the teachers and the representatives of IPC units, they had this opportunity to catch up, to fill the gaps they had through the project. And I'm very happy that the results of the project, well, that essentially now the program is being offered sustainably in our college. 3 courses already have been completed. 64 nurses got the certificates that they can work in the IPC unit, and I think we are the first, and up until now no one else does this specialization in Ukraine. We are happy to share our experience, we are happy to cooperate, we are adequate and flexible. Well, maybe we think so. However, we went on with project implementation in the baseline education as a cross-cutting theme. We have IPC in our college. Thank you. Thank you. You've mentioned the cross-cutting implementation of the project in the basic training of the specialists. Why is it important to form the culture of the IPC? Well, you mentioned that it's important from the kindergartens. Yeah, it's maybe even more important to start forming it from the kindergarten. However, IPC is not just knowledge, or it's not just a skill. It's rather a culture or a mindset, so to say, which we must start implementing from the early age. When students start getting proper skills, then health facilities would see the graduates who already have this subliminal understanding of infection safety, and essentially it's about the health of Ukrainian nation. But there are nuances. If we want the students to develop proper practices, they have to be following examples, and the examples are us, the teachers. And in the majority of medical colleges in Ukraine, the teachers are, well, doctors who don't know all the aspects of the nurse work. I have attended an internship, a placement in Israel, and my colleague was really amazed. How come doctors teach for the nurses? Well, there in the college in Israel, well, only some general disciplines like anatomy or histology can be taught by doctors. So mostly nurses are being taught by nurses, by other nurse practitioners. I'm very happy that we have more and more leaders in nursing who come to us not for the sake of the salary, to be honest, but they have a mission. In this way, we bring quality healthcare closer to patients. Yes, that is indeed very important, and sometimes people don't recognize this. So thank you for drawing our attention to the leadership in nursing. Why is this important for the future of the Ukrainian medicine? Timur, here, let me talk about money. Well, I'm confident that it's very expensive for the state to train a doctor to perform the functions which can be easily done by a nurse. So leadership in nursing is not about positions. It's about the ability to take decisions independently, to take responsibility, to inspire. And I'm really happy that in our project, the nurses were the leaders. Also, I want to talk about the expansion of powers of the nurses. It's being discussed now, and the more and more training spaces appear for the nurses in our country. And lastly, the matter of infection safety is a matter of health for patients, health for medical workers, and it's the matter of health for the Ukrainian nation. Thank you. Indeed, resilience, right, is about daily things like screening next to one's home, support for families, safety in hospitals, the leadership among those who spend most time with the patient, the nurses. All that helps form this resilience. Thank you so much, the participants of the discussion. I would like to say thanks again to Roman, Halina, Natalia, and Hanna. Thank you for being at this stage with us. Thank you.
Ladies and gentlemen, we are actually coming to the end of this great event. I know some of you prepared some words of gratitude and presence, so this is that time spot when you can do that. I don't have any list who's going to follow whom. If that's you and you understand I'm talking about you, just come here, join me at this stage.
Тримайте мікрофончик.
Have this mic. Greetings, dear friends. I'm Director General of Chernihiv Regional Hospital, Andriy Zhitenko, and I would like to express the words of gratitude on behalf of the residents of Chernihiv region, healthcare providers of Chernihiv who work at the front line region, who lived through occupation, both the civilians and the healthcare providers. On behalf of Chernihiv military civilian administration, I would like to express my gratitude to support TB control efforts in Ukraine project. Express my gratitude to people of United States and government of United States who continue helping Ukraine immensely, who continue funding such projects that are of paramount importance for us. Because your support and your colossal work and efforts gave us an opportunity to bring this medical assistance and medical help closer to people who reside at frontline areas and in hard-to-reach communities. You gave us an opportunity to improve in a very high-quality manner diagnostics and treatment of such a terrible disease as TB. Which is why, please welcome my words of gratitude. And I really want to believe that your projects will continue, and we strongly hope that such projects will continue being implemented in Ukraine. We strongly hope to your support and future cooperation with us. And I really want you to never have any depressions and desire to stop your work, because what you do is really a heroic act to find will, to find desire to go to the places which are constantly shelled, where drones fly over our heads, where drones are flying, Shahed drones. I believe this is very brave of yours, because a lot of organizations are saying no to us. They don't want to cooperate with Chernihiv region because of the security situation. So on my behalf, on behalf of regional hospital, I would like to say thank you and give you, Ms. Kunta, this thank you letter from the non-commercial institution Chernihiv Regional Hospital of Chernihiv Municipal Council for the support, for your efforts, for improving the identification of TB at initial stages, and for improving the quality of assistance granted to people with TB. Thank you for this cooperation, and we believe in the victory of Ukraine. This is from me, Andriy Zhidenko. Thank you sincerely. Thank you. And I would like to give the floor to representatives of the community that is located at the border. I don't even know how to call that nation that borders with us. Okay, Russian Federation. And they are performing very important tasks, and they are there to implement your ideas and your project. Hello, everyone present here. I represent the Horodnyanska community, which actually borders two aggressor countries, Russia and Belarus. This project, in the first place, gave an opportunity to our community to get high-quality services. Thanks to the project, the screening sites were arranged, all the necessary medical equipment was provided, high-quality expert support of the team was granted to us. That inspires and that gives an opportunity to learn more and to perform all the necessary screenings in order to identify at early stages various diseases. This is really and really needed and important in our community because we are subjected to constant shellings. This support is really, really tangible. We feel it because this project brought together not just healthcare providers, but also those from the cultural sphere, the social workers, because we have 12 screening sites just in our community, 10 at the medical institutions, 2 at non-medical institutions. And actually, people are afraid of people in white coats. And that's such a superstition. But we solved this issue in our community. Thanks to Path Project, people are eager to resort for medical assistance. You are saving lives. All the best to you. All successes, flourish, and achieve all your tasks. And the fact that you plan to expand, I believe you will be thanked for that by life. Glory to Ukraine. Glory to heroes. Thank you so much.
Ще хтось?
Anybody else? That's it. So, yeah, maybe we will come back to that a bit later. So, ladies and gentlemen, in the first place, I strongly hope that today you not just heard some new information, but rather felt strengths of our community. And I believe that's the key takeaway of today's event. And now I would like to hear the round of applause because I invite Oleksiy Bogdanov, Deputy Director of Support TB Control Efforts in Ukraine Project, in order to, so to say, summarize it all, crown it all, and share the vision of the future. Thank you. Thank you. Well, to start with, it was great to be in this room, and I hope that you also enjoyed this event. And I know that actually we've achieved it all thanks to your support, thanks to your work, and I'm very, very grateful for that. But yeah, that's still a round of applause for yourself. Because, right, we tried, we did our best, we were implementing some innovations, but they would not be possible And they would never be implemented without your work, without your desire to implement them. And it would not be adapted to Ukrainian context. And also, I want to say that today we saw just the tip of iceberg. And we've managed to present just what we had time to present, not to keep you here for an extensive period of time. But that was such a greatest pleasure that finally we all came here, we saw each other offline. You saw some of the representatives of our team alive, somebody not, but I would like our team to stand up in the room now for you to have an opportunity to see people whom you never saw, but with whom you are cooperating on a daily basis, and thanks to whom it all became possible. Thank you so much. I'm proud. I'm proud to be part of this big team, little big team, little powerful team. I would like to tell you more about the results and achievements, but as you know, you participated in plenty of efforts, and you said a lot today that in order to achieve these results, a lot of efforts had to be invested. Sometimes we didn't succeed from the first attempt. Very vivid example would be with the active identification of TB with the help of mobile X-ray brigades, when the first visits yielded the results we did not expect to have, and they required certain adaptation efforts, and we went all these adaptations. And also this pertains to trainings, adaptation of materials. So that's great when we see something is not in place, we need to change something, introduce some amendments, then test it all over again. So I would like to say thank you so much. You were very patient with us, and I strongly hope you'll be happy to continue cooperation with us, and thanks to the support of the government of United States, we will be introducing new innovations. We'll be adapting them in order to achieve sustainability. As we know, as of today, sustainability and quality can be achieved just by constant adaptation to new challenges, new conditions, new reality. And this time shows us that the current technologies, cutting-edge technologies are developing so fast, and we need to use them in order to improve your work conditions, improve the quality of our services, and cover more people with this assistance, cover those who need it, make it of better quality, make it accessible. And maybe this is it. I would like to wish you fruitful cooperation and great mood. And Victor, thank you. Thank you so much, Mr. Alexei Bogdanov. Well, you know, your words sounded as a toast, as if we were cheering for something. So, yeah, let's follow that. And I strongly hope we'll be raising our glasses in several years for other successes. So, actually, dear conference participants, today we have had a truly important day. 6 years of project work. It's not just numbers and reports, but we heard a lot of that today as well. It is thousands of stories, small and large, challenges, changes that together make up the bigger picture of our joint work. We have seen that innovations are already working in the regions, and that sustainability is not an abstract word, but the daily actions of doctors, nurses, ecologists, and communities. And we have once again seen that this is through partnerships and cooperation between the state, international organizations, communities, and people that the power to change the country is born. So I would like to thank each and every one of you here in the hall and those who joined online. Thank you for your work, for your dedication, and for your belief that a healthy future for Ukraine is not just possible, it's inevitable. It's already here. Well, if it's not here today, then tomorrow. And may this day be not only a conclusion, a summary, but in the first place, a new beginning in our joint movement towards a stronger, more resilient, and healthy Ukraine. Thank you so much. This round of applause is to you. Support each other. This is great to hear you. Thank you so much. This was Timur Miroshnichenko as your anchor. And this is the end of an official part of today's event. Thank you so much. Glory to Ukraine. Glory to heroes.
Дякую. Але, звісно, я закликаю вас не розбігатися.
Thank you. And I urge you not to go away because we still have an opportunity to spend some time together, to drink coffee, to take pictures. Maybe Mr. Alexei still toast for something. And in any case, stay here with us. Let's do the networking and let's spend time in great company. So I see you are still very inspired. And thank you so much for everything.